kids and coaches who have any symptoms should not come to practice. We only want kids that are feeling well attending practices.
Welcome, everybody, to the Back to Play edition of the Jimmy and Kyle Show. This is most likely our most important edition ever. We're talking about what we're going to do and how we're going to come back to the field. It's great to be here, and I'd like to say hello to my esteemed co-host, Kyle Rodiver, the technical director of the boys. Kyle?
How's it going?
It's going really well.
I came down to see my parents.
Did your dad or you see Sasquatch, or are you just out there hunting around, or what?
Just fishing around for one, yeah.
Okay, perfect. Jasmine Ayala, our physical trainer. Jasmine, how you doing?
Hello. Doing well.
Good to see you. Rich Reese, our girls DOC. Rich, how's it going, bud?
Very good, thank you.
I heard you're in Oregon.
We are trying to catch some waves down at Cannon Beach.
Fantastic. And our technical player, Mr. Alex Chersky. Alex, how you doing?
Hey, Jimmy, I'm doing good.
Good. Looking good. You know, the sun's shining. It looks like, where are you at? You in Federal Way?
I'm actually in Snohomish. And I'm
fantastic. Fantastic. And somebody I'd like to thank, guys, we're lucky enough to get back on the field in July. Somebody that's done a great deal of work with the state, with our governor, with Kyle Rodiver in terms of getting us back to the field. And when I say us, I mean Seattle United, but he's also had a huge impact on getting all the clubs in the state of Washington, all the youth sports back on the field. Dr. John Dresner of St. John.
Thanks, Jimmy. It's good to be here.
Yeah, fantastic. Hey, I just wanted to say to all our people watching today that all our customers, I'd like to thank you for the great amount of patience you've shown through this pandemic. I know how hard it can be with the kids at home, trying to figure out what to do, how to go forward. And I think our kids, our parents, everybody's shown a great deal of patience. I'd also like to thank all of you for the great number of registration we had during this pandemic. We didn't quite know how it was going to work and what the appetite for youth sport would be in coming back, but we're grateful and blessed to say that we've had a great amount of people register. And for that, we're very, very happy. I want to make a few points before we get going and before John takes over. First off, if you're not comfortable coming back to play in July, that's a family matter. That's something that you have to sort out with your family, and we're fine with that. When we say you don't have to come back if you don't want to come back, we mean that. I'd also like to thank the board of directors for giving us leadership during this really tough period of time. I'd like to thank our staff, Kyle, Alex, Jasmine, Kevin Long, for great leadership that you guys have shown during this tough time. And I really, really can't wait to see you all back on the field. I'm very, very honored to introduce John, who's going to take it away at this point. Dr. John.
Thanks, Jimmy. So what we're going to walk through is just some information about the Seattle United return to play plan and how to get our kids and our coaches back on the field safely. Just a little information about myself. I'm a sports medicine physician at the University of Washington. I also chair our medical advisory committee for Seattle United. And probably most important, I'm also the parent of a few kids who are in the club or have been in the club with Seattle United. So in approaching this, really approach this through different lenses, making sure that it's safe for our kids to get back on the field as much as possible. You know, with Seattle United, I feel fortunate that the leadership in the club with Jimmy and Rich and Kyle, Alex, everybody, safety really is first. And we've spent a great deal of time thinking about this. And I'm happy to report that Seattle United really has been a leader amongst some of the other clubs in the state in terms of creating some guidance to how to get back to the field safely. What's important for everyone to understand is that the information we're sharing and the recommendations we're putting forth are very consistent with public health recommendations. There's nothing we're doing that is ahead of or in front of Seattle and King County Public Health or Washington State Department of Health, or the CDC. These are key organizations that provide regulations and guidelines, and of course that we're going to follow all of them. Just a word on the pandemic itself. We all have a role in this. We all have some ownership of how the pandemic can get better. It definitely takes some teamwork, not just on our teams and within our club, but definitely our community. There's really good evidence that wearing a mask protects others and protects you. Hand hygiene, just basic things that we're going to review as we move forward. So happy to report, and I think everyone's aware, that King County officially moved to phase 2, Washington State reopening this past Friday on June 19th. There are some other counties in the state of Washington that are a little behind us, and several counties that are ahead of us actually in phase 3. What does phase 2 mean for us returning to the field? Well, once the fields are available, it means that we can proceed with small group training. Small group training includes groups of 5 players or less, and that the groups are spread out throughout the field. So this is one example of that, where we can have one team on one field in 4 different quadrants with an abundance of space for physical and social distancing, maintaining at least 6 feet apart at all times while they're doing non-contact drills, basically passing, dribbling, etc. And we'll walk through some of the progression of how we might go a little bit later as well. But right now, this initial rollout, what we're referring to is some small group training. As I mentioned, this will not be normal practice, and this is part of the regulations for the state. There's no physical contact allowed. We have to maintain some of that social distancing. In addition, we should remind our kids that there's no handshakes, there's no fist bumps, there's no high fives. Our players will be excited to see each other, but we need to keep them from hugging and things like that at this point. This is probably one of the most important slides for all the families to be aware of. We really want the kids who might be sick or feeling any symptom of a viral illness to stay at home. Kids and coaches who have any symptoms should not come to practice. We only want kids that are feeling well attending practices. What are some of the signs and symptoms of COVID-19? I think we're all aware of 3 of the big ones, fever, cough, and shortness of breath. In kids and young persons, the symptoms can be quite mild and even asymptomatic without any symptoms. But some of those milder symptoms might include a sore throat, just feeling dizzy, nausea, vomiting, diarrhea. An interesting symptom that's unique to the coronavirus, which is loss of taste or smell, or even an unusual rash. So if your kid has any of these symptoms, it's really important for them to stay at home. And we are definitely recommending that you check in with your kid before they leave for practice, that they're still feeling well. Also, just a comment that if there's a household member who's sick, we have to be very conscious of that. If that household member is suspected of having COVID or has been tested for COVID and those tests are still pending, your kid should also stay home and not attend practice. There's lots of questions about facial coverings or masks, and here are the guidelines that we're putting forth. First of all, coaches will be wearing masks or facial coverings at all times. The players should also wear a facial covering before and after training. So basically this means that they're wearing a mask from the car to the field, and then have the option of wearing that mask or facial covering during training if they want to, but they can take it off at the field. I think everyone's individual on this aspect. There are some facial coverings that are a little more comfortable or tolerable during exercise, but for the most part, when athletes are working hard, it is a little bit more difficult to exercise with a mask or facial covering on, but they should be wearing before and after practice. Hand hygiene and general hygiene is super important. If possible, we'd like all the families to supply their kids with an individual bottle of hand sanitizer that they can use before they get to the field. It's really important during practice that they're not touching their face, etc. While they're playing. Immediately after practice, we would recommend that they use some hand sanitizer before they put their mask back on. And then, of course, we're recommending that the kids avoid spitting. If you have a child who you know generally spits, please provide them with their individual cloth that they can carry around during practice so they can spit into that and not necessarily onto the field. There'll be no shared equipment, and we've talked to all the coaches about this. The old habit of having the players sort of set up equipment or pick up cones, etc. That's not going to happen right now. So coaches will be responsible for setting up and picking up all the cones. They'll be disinfecting those at the end of the day. There'll be no pennies or shared pennies during training right now. And then, of course, all the players should bring their own water bottle, not share water bottles, bring their own soccer ball, etc. There have been some questions about what happens if a ball moves from one quadrant to another quadrant. Honestly, that's sort of no big deal. The other players can simply just kick it back to the other small group. Passing a ball around with your feet is a very low risk endeavor. We'll hear from Kyle and Alex regarding some of the examples of the practice plans, but the coaches have done an outstanding job to develop some training plans that don't involve lines or huddles. We're all used to the coaches sort of bringing the team together for a beginning or end of practice huddle, or perhaps to instruct about what's going to happen for that particular drill. We're going to do this with more physical and social distancing, perhaps even some practice plans reviewed via Zoom before the players get to the field. So we're going to avoid lines and huddles at this point. We're going to do our best to stagger the practice times, leaving at least 10 minutes between one practice and then another team coming to the field. This is really important so we don't have crowding on the sideline, because right now that's not allowed. So the coaches know that they need to be on time. And then, of course, once the practice ends, the kids essentially can't huddle and socialize. They need to go straight to the car. Where possible, we're going to try to pre-designate where kids will enter the field and where they might exit. So, for instance, if it's a confined space or a confined field that has a couple different gates, one gate might be to enter and one gate might be to exit. If that doesn't work out perfectly, that's okay too. The kids should be in a mass. It's a very brief time that they're passing by each other, etc. But we're going to do our best to stagger the times and leave plenty of time so there's no collection of players on the sideline. Lots of questions on carpools, and I'm going to address this in just a little bit, but in general, we really want to limit or avoid carpools at that time if we can. We recognize that for some families that won't be possible, and I'm going to provide a little more information on that in just a little bit. Again, no gathering or delays. This is an important reminder for the kids that we want to avoid hanging around before or after training sessions. That when they place their bags down, it's not going to be in one big group as a team, but basically to the sideline close to the quadrant of the field that they're practicing in, and that their bags should be placed 6 feet apart. For the parents, there are some new rules and regulations that we have to abide by as well as parents. This is not an opportunity where you can stand on the sideline and watch practice. It's actually not allowed by the state right now. So we ask parents to basically drop off their kid. If you have small kids that you feel you need to walk to the field, that is fine. Walk them to the field, hand them off to the coach, and then you can go back to your car and then come back to the field when it's time to pick them up. If you're a parent and you are dropping off your kid, I strongly request that you wear a mask and model what the kids should be doing as well. So parents should be wearing a mask, and right now is not an opportunity where the parents could be on the sideline. When we are able to move to other phases, it's possible that parents will be able to be on the sideline, but I would anticipate that it's going to be different than it was before. Parents will need to be in masks. They'll need to be physically and social distance from each other so we can create the safest environment possible. Just a comment on some health conditions, and this is really important, and Jimmy alluded to this earlier. Each player and family should feel safe with their decision to play. Playing youth soccer is voluntary. It's a great opportunity. but it's also not required. And there's absolutely no penalty if a player or family is not quite ready to return to play. That's fine. There's also some underlying health conditions that we should be aware of, that if your child has one of these health conditions, I would recommend that they have an individual evaluation with their medical provider, just to talk about if this is the right time for them to return to sports, or if there's any special precautions that they need to go through. Some of those underlying health conditions that they might have would include diabetes, uncontrolled or severe asthma, obesity, medications or health conditions that weaken the immune system, chronic kidney or liver disease, or a serious heart condition. I also want to bring up another reason that you should consider seeing a medical provider before your child comes to their practice, and that's if they've had prior COVID-19 illness. And when I say that, it means that they were confirmed to have the illness by a positive test. For sure, if they were hospitalized, if they had a severe illness due to COVID-19, they should definitely see their medical provider and make sure that they're safe to return to play. There are some rare complications that are more common in adults, but they are related to the severity of the illness. So the more severe, the more important it is that you see your medical provider. And if your child did have prior COVID-19 and they have ongoing symptoms such as chest pain, shortness of breath, or decreased exercise tolerance, that's another really important reason that they would see their medical provider. If you can't get a timely appointment with your medical provider, UW Medicine, Stadium Sports Medicine Center is very happy to always see Saudi United players, and there's a mechanism for that. I believe some information on the website where you can contact one of us, and we'll facilitate some of those appointments. So some reminders for the parents before we get out to the field, and there'll be a lot of information coming to you in the coming days. You should review the return to training plan written document that will be provided to you. There'll be a guidance sheet on COVID-19 that we want you to review, initial, and sign, and then return to your coach. This is just to make sure that you're aware of some key issues related to COVID-19 and returning to soccer. Try to get some hand sanitizer for your child and make sure they have a facial covering or mask. Just a reminder about that daily symptom check, especially before they go to practice. We only want the healthy kids who have no symptoms coming to practice. Contact your coach if they're sick. We need to understand all absences from practice if it's for any reason, and especially if they're sick. And we're going to really push to update Team Snap, because we're going to rely on Team Snap for some of our contact tracing and contacting families if we need to. So what will it look like, into the future for our on-field training progression? So as I mentioned, right now we're in King County Phase 2. This first week that we get back to practice, we're really talking about those small groups, one team, one field, maybe 4 quadrants. I think pretty quickly on week 2, we'll remain in those small groups, but I think we can move to having 2 teams on one field where we have basically 8 quadrants to a field. There'll still be an abundance of space and more opportunity for the teams to get out there and train. We'll be basically stuck in that formation until King County can move to Phase 3. When we can move to Phase 3, we can have more normal team training that includes physical contact with less than 50 persons per field. That probably includes 2 to 3 teams per field. And when we're in Phase 3, that's when we can consider things like scrimmages and games. Just to address some of the common questions that come up, and one of them I think that affects all of us as parents is the idea of carpooling. Again, right now, if you can, let's avoid carpooling. But if you have to carpool, there are ways to make it safer. The people in the car should be wearing a mask. You should make sure that the kids are wearing a mask. And if you only have a couple people in the car, you can actually create some ways for them to physically distance from each other based on the spacing and configuration of the car. So just give that some thought. And this is really important as well. Parents in the club are wonderful and always want to help. And there's a lot of questions about what they can do. We don't want parents on the sideline, but I do think it's reasonable for each team to have one parent. That could be the team manager organizing who that parent is, or maybe designated one parent per practice who is basically just there to help with the flow. This is not a security guard or a police officer. This is someone who can give positive reminders, positive encouragement, or answer questions about where their kids should go, and just help the coach out. Just reminders about the hygiene, about wearing their masks, etc. So again, just creating a positive environment and helping with the flow. I think that's a reasonable way for the parents to help out, maybe organized by the team managers. Let's spend a little time and talk about close contacts. There are a lot of questions about what a close contact is, and not everyone who comes in the general vicinity of someone who is ultimately diagnosed with COVID-19 is considered like a high-risk close contact. So if we look to the left here on what a low-risk contact would be, so this is someone who has always maintained a distance of 6 feet or greater from the individual who was diagnosed with COVID-19. There's been no physical contact with the individual. They were never in close contact of them heavily breathing or sneezing or coughing. And essentially, this includes basically our small groups. So our small groups are in configurations where there really shouldn't be close contact. And certainly if your child is in a different group than where maybe a teammate is diagnosed with COVID-19, there's essentially no risk if there's no interaction. So on this low risk group, there are no restrictions. These are CDC guidelines. Testing would be optional if you were really concerned, or if you couldn't confirm that there was no interaction. And as usual, really for everyone right now, we recommend that they self-monitor for their symptoms. So to the other side are high-risk contacts. So high-risk contacts are defined as an individual who's within 6 feet of the infected person for 15 minutes or longer, or perhaps has direct exposure to respiratory droplets or secretions, such as being coughed on or sneezed upon. If there is a high-risk exposure, these are the individuals that need to self-quarantine, where testing is recommended, and that self-quarantine is for 14 days. And then, of course, they're going to continue to self-monitor their symptoms. The reality is that once we move back to physical practice and scrimmages and games, that soccer probably falls somewhere in the middle. Not everyone on the field necessarily is going to have one of these high-risk exposures with someone. So how we address this is still something that a lot of sports medicine professionals and infectious disease professionals continue to think about. And I think we'll have some data and evidence from clubs that are, and leagues from around the world that are going ahead before us. And we'll approach these very cautiously, carefully, and always erring on the side of health and safety for the team and for the individual. But this is a general breakdown of what might be low and high risk. With that in mind, I think it's important as a club that we monitor really closely what happens as we roll out. We want to make sure what we're doing is safe. That if there are infections, they're no different than the chance of getting infected in the rest of the community, that the prevalence is no different. So we've developed some surveillance and contact tracing procedures. We have individuals like Jasmine who have been trained officially with a contact tracing course through Johns Hopkins. Part of this for parents is please update your team snap so it is accurate about whether or not your child attended practice. Coaches will also update Team Snap as well. If you don't attend practice, I request that you put a comment in there about why. If you're out of town or something like that or can't make it, I think that's fine. If they're sick, then we want to know about it. And part of our procedures will be to contact families if they have a child who's sick and missed practice. If we don't know why you missed practice, we're going to contact you by email or phone and just try to understand how to best guide both that family and the rest of the team. We've also developed some coaching reporting forms and other resources. And at this point, I'm gonna hand it off to Jasmine to just show you some of these as examples of the resources that we've created for the coaches and the club.
So what we've, as Dr. Dresner stated, that we have educated the coaches, and we have plenty of forms for them to be able to see, to reference to. We have these coaches cards that we made for them, and it just gives reminders of what that presentation states, of just kind of those signs and symptoms, and then also just reminders of wearing the mask, making sure that they use their hand sanitizer, and then also just contact information just in case there is a positive case and they need to contact one of us quickly. There's also another document just kind of going of that reporting form. So if there is a known positive case in a team, a coach can come and report that and give the information that is on Team Snap as well, so that the coach, so that me specifically, can contact those families and just kind of get more information about whether it is a positive case, whether they're just not feeling right, of just a regular sickness. But it is important to know if it is a positive case, because then we can go through the procedure of the contact tracing. And just to kind of touch on that, what we do is we still keep confidentiality within the team. So if somebody does end up becoming positive with a case, we're not going to specifically share that personal information with everybody, but we will let the people in that specific small group know that someone has gotten the case, has been infected, but just so that they're aware. But we will not distribute any information of who that was or anything like that. But with that said, if that happens, we do recommend getting tested. In a positive case, then that individual will need to get tested and cannot return until they have been cleared by their physician. So that we will be in communication with that specific family. And that will be me, and then also 2 other medical interns who have been also trained in the Johns Hopkins COVID-19 contact tracing methods. So they know the procedures and everything, and following HIPAA rules and making sure that confidentiality is followed. And then for the coaches, again, just a reminder that the coaches do know they have been educated on proper proper care of making sure that they are wearing their masks and that they are making sure that everybody is 6 feet apart and everything. As for the kids, as Dr. Dresner mentioned, masks are strongly encouraged for the kids, but again, if they do not feel comfortable or having trouble breathing because of the mask while playing, that's okay to not have the mask, but to have that on when walking to and from the field to their car, and if they're becoming in close proximity to anybody. But now I'm going to pass it over to Kyle, who was going to go over just the return to play field layout.
Thanks, Jasmine. So I'm going to show some field diagrams of what phase 2 and what phase 3 look like for us. So in this first slide, what we see is one team on the field. This is a team of 20. Some of our older teams have 20 players. If it's a team of 16, we would break them into groups of 4 for each quadrant. There are buffer zones that are run down the middle to quadrant the field off. I think it's very important to mention as well that 6 feet is 2 yards. That's not a ton of space when you really look at how big a soccer field is. And so when we have these kids in a quadrant of a field, you're talking about a 55 by 35 yard field. or space for these kids to operate in, which is quite large. The coach will stand in the center of the field in the center circle. They'll operate within that area. Again, that is a 20-yard diameter center circle. So plenty of space for the coach to be away. The coach will be wearing a mask like Dr. Dresner had said. This slide shows what two younger teams would look like on a field. So probably two 7v7 teams would look like on a field in reference. But you have the coaches stand at opposite ends of the field so that they're away from each other. You still have your buffer zones, and then your players still have quite a bit of space there, 40-yard by 25-yard space to operate in. And Alex will go into more detail about how the training will operate from a curriculum standpoint to ensure that the spacing is met. But these are the guidelines for phase 2. Now, phase 3, what we have is we're allowed to have 50 players on a field, 50 people on a field. Again, what we'll do is instead of having the 8 teams per field like we have in the past, we will have 3 teams on the field, 3 11v11 teams on the field for 48 players. We'll have a coach in the center circle with his players or possibly out to the outside. Again, you're talking about 70 yards by 33 yards worth of space on an average size 11v11 field. And that doesn't include some of the off-field space that we might have as well. So still plenty of space once we get to that phase 3, according to the governor's guidelines. The last slide I'm going to share is what it would look like with 4 younger teams on there, 4 teams of 12. Again, they'll have a quarter each. As we've all done before in the past as coaches, we've had a quarter of a field, and when we have a quarter of a field in the winter, we're thanking our blessings. And by 33 yards, you'll still have your buffer zones. You'll have the coaches stand, off the field, probably in the corner or on the sidelines somewhere. Like we mentioned earlier, the bags will be placed at least 6 feet apart, so 2 yards apart, on their own side of the field. And players will go to their bag. Hopefully this keeps them from congregating during water breaks. And there are going to be other rules that come out from the Parks Department where there's going to be entrance and exit points. Parks Department has mentioned that they will be closing some of the parking lots to these fields so that people aren't congregating in parking lots. So once we get that information from Parks along with the fields, what we'll do is we'll create some updated field diagrams for those fields that explain where these entrance and exit points are to get onto the field and the best way to drop your player off. There is also, we are not allowed to get onto the field until our reservation begins. So when you get the field schedule, field schedule says your session starts at 5 p.m. You cannot get out of your car and get onto that field until 5 p.m. Same goes for the coach. And then at the end of the session, car within 15 minutes. Parks is going to exit the field and enter the field properly. We're in compliance with the governor's orders and what the Parks Department is asking of us. And to give you a better idea of how the curriculum is going to work, how we're going to help enforce the fact that there is going to be this minimum amount of space, Alex Chersky, the technical director, is now going to give you guys an idea of what this curriculum looks like.
Thanks, Kyle. So what we're planning on doing to hopefully remove as little doubt as possible and reduce uncertainty in terms of, if a coach is on the field by themselves, we're sending out videoed training session. Here's a reminder of just a list of reminders prior to the training session in terms of just reminding your players how to communicate, obviously the 6 feet distance, getting there early to set up, being prompted on time and early as possible. If the restrictions of not being on the field until the reservation starts, we'll have it organized as to, okay, the session may start, so many minutes after it, so that the coach is set up. The diagrams, as shown here, are set, and the players know exactly what they're going to do. So this is an example of a younger team session where the players wouldn't be doing any rotating of grids or of positions, but rather working in their own technical boxes. We think that, what we'll do is send out curriculum by age. Obviously, a younger team may be able to follow instructions with a little bit less detail than an older team. So we're just working on making sure we're getting all of that out to the right ages and they're going by the book. And what you're seeing here is what a coach would receive for the curriculum. So it may look a little bit different with coaches having their smartphones out so that they see the movements, they see the progressions within the session. As I said, so we're all doing the same thing, that nobody's out there on their own, just making it up as they go. I think the first week or so, the first 2 weeks, we have to be very, very particular and meticulous about these details. So everyone will be doing a similar session, a similar setup, and progressing as we want, so that there is no risk of players coming into contact with each other, or for any problematic rotations. So an example of an older session, just doing some technical work within a diamond here. This has rotation after a player goes through, but as you see, the blue cone there is where the player rotates out. So it's very specific. It's very clear as to keeping that distance and keeping that, as you see right there, that distance, and so that there's no discrepancy as to what or where a player should be moving. Right, we have the dimensions where the coach stands, and then again through the progression as well. It varies, and the setup stays pretty much the same, so that coaches don't have to move cones around between sessions. We're trying to really maximize that 50-minute time on the field, if that's what we're going to be getting. But then also the one at a time workload, it keeps in mind the necessary workload for a player that's just coming back. We have to be cognizant of that as well, so that we're not overloading and maxing the players out. I know people are going to be excited to be training and excited to be playing, but we have to be aware that a lot of these kids haven't been training full on, even though they've been doing their homework and doing their individual training at home. It's going to take a little bit of time to get their fitness back too. So we're going to ask the coaches be on top of the workloads, and that'll be measured and timed as well, as shown on the video. Just going through a couple more rotations here, adding some variation even within having a rondo. We're making sure that there's no contact, there's no tackling. It's rather reading the pass or intercepting the pass, and just going about it that way, so that we're very clear, we're very organized, and every coach knows exactly what they're going to be doing.
Thanks, Alex. Really appreciate that. We sent out a quick questionnaire with the invite to this webinar, and we've brought in some parents' questions. So I'll run through those questions and hand them off to Dr. Dresner, Jasmine, Alex, and Kyle. So our very first question is directed to Jasmine. And the question is, will players be required or have the option of wearing the mask when play resumes? And I know we went over it a little bit, but again, this is one of the concerns we are hearing from parents.
Yes. So just to be more specific on that, is just that we do strongly encourage that players wear masks or facial coverings to and from the fields, from the car to the field, and then from the field back to their car. But if they're playing, when they're doing their technical work, they can wear one if they feel comfortable to. But if that's making it more difficult for them, they can take that off. But as Dr. Dresner mentioned, if they do take it off when they're coming back to their bag and they're leaving, they do need to put on that hand sanitizer and then put their mask back on for when they're leaving the field. So playing wise, it's not a requirement, but when coming to and from the field, we are very strongly encouraging that.
Great. Thank you much. The next question again is directed to you, Jazz. Can you expand a little bit upon your contact tracing methods? And Dr. Dresner, I'm not too sure if you want to jump in on that as well, just to follow up, but again, be a great answer to know.
Yeah. So just to be a little bit more specific about that too, is that coaches will use the team snap to report any absences that their team has. And if they do report or see that a parent has reported that either their kid was sick or that they were a positive case, then we will be notified of that as well. So I and my team of the medical interns will be tracing the team snap. And then also if a coach ends up reporting on that reporting form that I showed when it is known of a positive case, we will contact those families and just kind of get more information about it, whether it is a positive case or whether it was just a sickness. And then from there, if it is a positive case or they're not specifically sure, but they do have those symptoms, we do recommend getting tested so that we know that. And from there, just as Dr. Dresner said, if you have difficulty going to your own physician to get tested, you can use the relationship that Seattle United has of going to UW Medicine to be seen there. And you can contact me and I can refer you to get the information to call them. But from there, if it is a positive case, then we will notify the small group that child was within. So the group of 5, we will notify those players that somebody has been tested positive and go through the steps of just keeping in contact on whether they are feeling sick or starting to get any of the symptoms. And also saying we recommend getting tested as well, just to make sure. And from there, we go from making sure that confidentiality, again, just reminder that we will not share any information to other players. We're just going to let them know that there was a positive case, and so that they know the next steps to do. And that positive case, the player will take the steps given by their physician of staying quarantined, staying at home, and then when they are cleared by their physician, they can then come back to practice.
Great. Perfect. Doc, anything to follow up on that, or are you good for the next question?
I think Jazz did a great job outlining what it's going to be. I just emphasize that, we'll definitely keep the confidentiality and balance that with notifying, the parents and teams from the team that maybe someone has tested positive. In the small group setting, they are physically distanced. And so if you remember that slide, it's sort of a low risk contact where testing, I think, is reasonable and optional, but not necessarily required by pure public health guidelines. And that hopefully that small group can continue to train. If they have had close contact and more of in the high risk setting, if we're in phase 3, then the equation changes a little bit, where we definitely want to make sure that those families are getting the testing that they need. The testing won't be provided by the club. They're going to have to work through their medical provider to get testing. And if they can't, then certainly UW Medicine is happy to help out.
Perfect. Dr. Drez, I'm actually going to skip the next question that I had for you because you just answered it right there. So the next question I have for you, if a parent buys a medical grade contactless thermometer, for their household, would Seattle United have any concern if they loan it to the coach or the field marshal parent to check players before games or practice? Is it needed? Is it recommended? Thoughts on that?
Yeah, that's a really good question. Right now we're not recommending that we do, sideline temperature checks in the kids, especially in this initial phase 2. And part of it is we don't want all of the kids coming in contact with one person, either the coach or whoever that parent or field marshal is. We want everyone to keep their physical and social distancing. There's no doubt that COVID-19 can present with fever, and fever is an important sign. What's not clear is when we use temperature as a screening tool, how good that is, especially outdoor in the summertime, etc. And so these contactless thermometers are reasonable. What I'd say is use it for your own child. I would not use it and bring it and ask the coach to do it on their players. That's not what we're recommending at this point. If the evidence evolves or something changes, then we can reconsider this. But right now, I'd say it's for individual family use and not for the team.
Great. Thank you, Doc. Kyle, quick question to you, because obviously you've been working with all of the clubs in the surrounding area, in the state and so forth throughout all of this, which we all appreciate. Question revolves around summer tournaments. How are summer tournaments reasonably going to go forward, given that nothing has changed in respect to COVID other than the availability of ICU beds? Obviously, Doc, feel free to jump in on that because, some things have moved forward and so forth.
Yeah,
Kyle,
well, I'll just talk about the summer tournament part. Right now, what you see are basically tentative dates. Nothing is set in stone. Clubs are hoping and preparing for tournaments, but are also very well aware that these may not happen. You look at Crossfire Challenge, which has their dates listed there in the middle of July. Everything is predicated upon people let's say that takes place, but we're still in phase 3. We would not attend Rainier Challenge because we are not supposed to leave a higher risk area and go to a lower risk area. They don't want the transmission happening, so we would not send our teams there. The clubs have all communicated really, really well with each other about what their participation will be in the tournaments. We have plans, obviously, that we've sent out that are very tentative. And if we are in phase 4 by this point, this is what we're looking to do. But past that, we just have to keep an eye on when we're getting into each phase. I believe phase 2 started yesterday for King County. So you're in that phase for at least 3 weeks. I would venture to guess we're probably going to be in there a little bit longer, but we can't play in tournaments until we get to phase 4, really.
Perfect. John, anything to add to that, or are you good with that?
No, I think Kyle's absolutely accurate. I would just say that from the pandemic standpoint, we have made a lot of progress, not just in our hospital capacity and ability to treat the sickest of patients. At one point, well over half of hospitalizations were related to COVID. Now it's down to about 3%. But most importantly, the prevalence of the infection is way down compared to what it was. It's still not zero. We have on average, about 40 new cases diagnosed per day in King County. But that's down quite a bit from what it was at its peak in mid-April. So we are doing a lot better, but the infection is still out there. And that's why it's so important to have all these continued, hygiene and physical distancing recommendations.
Yeah, great. Just to reiterate on what Kyle was saying, because we, as a directorship group, we are talking to all of the surrounding clubs who are running these events and getting constant feedback on their dates. I know that some of the clubs will send out information and your managers and parents may get it. However, note that, Kyle, Alex, myself, Jimmy, we're talking to the directors that run these events, and we will feed live information as soon as we get it on the status, and we will always refer to John and the medical committee with regards to our status, obviously following our county and our governor's lead with that.
Yeah.
Great. Next question, and this is to you, Alex. How do we keep the players from touching the equipment, especially the ball, or how do we keep them safe if they do such?
Right. I know there's some concerns about that for sure. So, we're instructing our coaches that all cones, bibs, which they won't even really be using. Coaches will be touching all of that and there to remind their players and constantly tell their players, don't pick up the cones, don't touch the other players' water bottles or any type of gear that is brought to the field, typically by the coach. In terms of the balls, what I'd say is that if a player brings their individual ball to a training session and they, if it's a technical day where they're just working on dribbling on their own, well, then they're only touching their own ball. There's no problems there. We will do some passing patterns and passing exchanges as shown on the video there, but the ball staying on the ground, we're not picking it up and heading it at this point. We're doing very low risk technical exercises, and with anything in terms of a ball going into another grid, as Dr. Dresner said, you simply pass it back, and if the ball stays on the ground and we emphasize that technical aspect, I think it's a very low risk, safe way to go about the exercises. So we'll manage it and we'll be very cautious, and we'll be very safe with that.
Great. And as Dr. Dresner said when he was going through his slides, the coaches will be there before the players get there. The stations will be set up. The players will basically Zoom or be given message before the training, the day before, being given what the layout of the training session is, what station to report to. So really there should be very little crossover. And again, the equipment will be put out and retrieved by the coaches before and at the end. And I don't see us doing pennies these phases, and if we do, it would be the players actually taking the penny home and being responsible for their own individual shirt. Anything to add there?
Rich, this is Jimmy. I've been coaching for over 30 years, and mind you, usually coached older teams, but I've been trying to get the players to pick up the cones for 20 years for no luck with that. So I think not having the players pick up the cones would be something we can accomplish.
Yeah, exactly.
Rich, I would just add that I think what the parents might be referring to is, at the end of practice when the player needs to pick up their ball and use their hands to put it in their bag, what do they do? And, first of all, the ball is a very low risk object and it's passing back and forth on the field. Even if it is not, perfect setting and there's some concern, if the player picks it up with their hands, puts it in their bag, and then uses hand sanitizer, I think they're very safe. Then they can put on their mask and they go back to the car.
Yep, agreed. Alex, next question for you too. Can we make sure players keep their masks on when they are not playing? I.e., I know Jasmine and Dr. Dresner have went over, but will that be reinforced with the coaches, to give that directive on the sideline?
Yeah, absolutely. So, leaving training and coming to training, obviously we want players in their masks during the sessions. It's obviously optional, but, coaches will be instructed to reinforce all of the guidelines set forth, including masks, before and after training, with the in collaboration with the field marshals, the coaches can manage all of those groups that probably need a reminder or perhaps need a reminder.
Great, thanks, Alex. Yeah, I think both Kyle and myself, Dr. Dresner, we all have children in the club, and I think the biggest thing that we need to lean on there, as much as we can give out advice, it's very difficult to police it. This is where we're going to be leaning on the parents for their support and for their guidance to their child's habits to and from the field. And everybody's been so great so far, but again, as much as we will try and keep them safe on the field, we need the same from our parent group, getting them to and from the field with those friendly reminders to our little ones, because I know my 6-year-old will fight me for it, but she is now learning the case of putting that mask on and why it's important to others, not just herself. Okay, Kyle, I have a question for you. What stage of reopening will we need to be at before players can tackle and play in contact games, contact scrimmage sessions?
So that part, it's still a little bit up in the air. Department of Health obviously gives continual guidance to the state, to the right now, phase 3 allows some counties and most counties allow tackling and friendlies and games to take place in training for phase 3. But I know there are some that don't. And they have said that phase 3, they still don't want contact in those phases. Anything can change between now and phase 3. Phase 3, we're like I said, we're 3-4 weeks out at least from that. They will likely, they being the Parks Department, Department of Health, will likely come up with stricter guidelines or more concise guidelines as we get closer to that date. And they will clarify what it is they want to happen or not happen in phase 3. Phase 4, obviously, that the restriction is lifted completely. It's more about phase 3, and that right now is a little bit of a gray area with parks departments. But they have said that right now most are planning on allowing the contact in training, but they've also reserved the right to pull that back and say, no, we're still going to stick with the social distancing guidelines. You can have more players on the field, but we're still going to ask that you don't have contact, don't play scrimmages, friendlies, and whatnot in training. So that's where we're at right now.
Question for you, Kyle, with regards to Team Snap. Will there be a section in Team Snap to list out if a player is feeling ill and they have symptoms, or if they're actually just missing training? How can we record that, and what will that communication consist of?
Yeah, there actually is. So in Team Snap, where you mark your availability, yes, no, maybe, there's a note section on there that you can leave a note. If you want to just say sick, what we can do is have Jasmine or one of the contact tracers follow up just to see what they are. If that makes you feel more comfortable, you can put your symptoms in there if you'd like. That's up to you guys. But it also can be used to record, hey, we're on a family vacation on this date. And that would actually be super helpful for us anyway, for people to use that tool at all times. But yes, there absolutely is that ability to record that on Team Snap. And that will help with Jasmine and everyone else being able to trace these instead of having to get 100, 200 emails from people saying, this is why I missed training.
Yeah, I think that's the main factor, right? Is that consistent form of communication, which can go from, families, players, to the coaching staff. And then with yourself and myself and Alex, we all have access to every Team Snap. So again, we can share that information within the right parameters to the right people. And again, well communicated.
Yeah, that's
great. Thank you, Cal. Does anybody have anything to add to that? All good? Great. One, I just want to say thanks to you guys. Great information. I really appreciate it, Dr. Dresner, especially you, because you've sat in many meetings lately. And as a parent and a volunteer, I can't tell you how much I lean on you, and I appreciate you. Jimmy, I'll pass to you for any closing remarks.
Well, again, I just like to thank all the parents for sticking with us. I know it's been a real tough time. I'd like to thank all you guys. Again, Dr. Dresner's been a superstar. Our board of directors have been very supportive. I would say I need a favor from all you parents. We need to follow the protocol. We need to be diligent. We need to keep our kids safe. That's our number one priority. And again, we can't wait to see you guys on the field. And thanks a lot for being part of the Seattle United family.